We welcome you to the third installment of the 2023 Expanding Research Partnerships webinar series. The series theme is leveraging collaboration to address key challenges to occupational safety and health research, training, and practice. Today's webinar will focus on OSH practice in the workplace of the future. Now, it is my pleasure to introduce Dr. Sarah Faulkner, NIOSH's Associate Director for Research Integration.
Thank you, Nicole. And on behalf of NIOSH, I'd like to welcome everyone to the September installment of our Expanding Research Partnerships webinar. Today, we're really pleased to bring together partners from the occupational safety and health community to learn about innovations in occupational safety and health practice. It's my pleasure to introduce our distinguished speakers. I'll briefly introduce them all now so we can move quickly between presentations. Our first speaker today is Dr. Robert Embry from the University of Texas. Bob is Vice President for Safety, Health, Environment, and Risk Management for the University of Texas Health Science Center at Houston and Professor of Occupational Health at the University of Texas School of Public Health. He has over 40 years of experience in health and safety with master's degrees in health physics and environmental sciences and a doctorate in occupational health. Bob holds the unique distinction of being one of a very few persons to hold national board certification in all 7 main areas of health and safety. Our second presentation today will include 2 speakers from NIOSH, Dr. Scott Ernest and Commander Elizabeth Garza. Scott is the Associate Director for Construction Safety and Health at NIOSH. Prior to joining that office in 2015, Scott was in the engineering branch at the NIOSH Division of Applied Research and Technology for 10 years, where he was branch chief. He's a registered professional engineer and certified safety professional with master's and doctoral degrees in industrial and mechanical engineering. Liz is commander in the U.S. Public Health Service Commission Corps at NIOSH. She has 11 years of experience in the Office of Construction Safety and Health and serves as the coordinator for the construction sector program. Prior to joining the Office of Construction Safety and Health, Liz worked in the NIOSH Office of the Director assigned to the Global Collaborations Program. And prior to her work at NIOSH, she was in the private sector as a public health analyst for Science Applications International Corporation. Our final speaker today will be Dr. Mitchell Rosen. Mitch is Associate Professor and Director of the Center for Public Health Workforce Development at the Rutgers School of Public Health. He has over 35 years of experience in developing and implementing occupational safety and health programs. His interests include workforce development issues for public health professionals, specifically in the concentrations of occupational health and safety, public health capacity development, and emergency preparedness. Throughout his career, he's developed partnerships that enable his program to achieve goals that could not have been achieved without them. And now we're ready to begin our webinar. Approximately 1-hour presentations from our speakers will be followed by a question and answer session. Please put your questions in the Q&A box at any time during the webinar. And now, without further delay, I'd like to invite Dr. Bob Embry to our virtual podium. Bob?
Thank you, Dr. Faulkner, and greetings from Pinehurst, North Carolina. I would normally be speaking to you from Houston, Texas, but I'm very fortunate to be on the road, and my family is helping me out here. So special thanks to Pat and Krista for setting me up in this arrangement. What I'd like to talk to you today about is a project that we've been working on for about 25 years at the University of Texas Health Science Center, where we're transforming from a traditional to a more holistic occupational health and safety program. And I'll explain what I mean by that in just a second. But I would like to acknowledge my colleagues here, Dr. Scott Patlovich and Dr. George Delclos. The 3 of us recently published a paper on this exact topic in the Professional Safety Journal, and that's what I'm providing today is essentially a synopsis of that paper. It's for some reason I'm clicking for, there we go. Okay, so I think I'm kind of preaching to the choir here for the participants in this webinar, but we certainly are experiencing a dramatically changing workplace where we have changing demographics. There's this greater burden of disease, and an area that we're very interested in is the notion of mental health considerations, because the University of Texas Health Science Center now hosts the largest inpatient mental and behavioral health hospital in the country. So there's workplace concerns, workplace safety concerns there, but also there's issues that I think the average occupational safety health professional needs to be cognizant of with regard to being respectful of mental and behavioral health issues in the workplace. There's been all these employment arrangement changes. A good example is COVID-19 and people remotely working, working with PPE, changing expectations with regard to whether it's PPE or vaccines or whatever. There's the intensification of work demands, all sorts of issues, built environments, and there's the global drivers. But all that in mind, we have to remember that we have just one body, and that body goes from home to work and back home. And therein lies the opportunity for us to collectively expand our partnerships to address worker well-being with a more innovative and holistic approach. And that's what we've been trying to do through this shared governance approach at the Health Science Center. I will point out in the fine print at the bottom is this, what I'm summarizing is this paper that we just published. But what was interesting about this particular paper is that the president of the American Society of Safety Professionals actually highlighted this work in their opening remarks for the journal that this was published in. And for those of you who don't read the Professional Safety Journal, that is the journal for the American Society of Safety Professionals, which represents over 35,000 members in the US and abroad. So just a little sluggish in moving forward here. That's as far as the slides changing. So for the other speakers to be aware of that, it seems to not advance. So maybe if someone behind the scenes can advance the slide, that'd be fine. I'm clicking. There we go. So just a quick description of the Health Science Center in Houston. It goes by shortly by UT Health Houston. We're one of 14 component institutions of the University of Texas system. We're part of the Texas Medical Center in Houston, which is the largest medical center in the world. It's the 8th largest business district in the United States. That's a long way of saying parking is impossible. We consist of 6 schools and both inpatient and outpatient clinical services, and serve over 18,000 population for students, faculty, staff, and we're spread over a footprint about the size of the state of Connecticut. So I guess you can never mention Texas without saying something large. And so the office that I oversee is called the Office of Safety, Health, Environment, and Risk Management. And our job is simply to help people go home as healthy and as safe as they came in the door. Just a quick, I apologize for the eye chart here, but what I want to do is just show you the org chart for a department, because the blue boxes at the top are the administration. And then typically for environmental health and safety programs, there are programs that are focused on the specialty areas. So for those who work with potentially infectious agents, that would be the orange group, the biosafety group. The purple would be radiation safety. The red is fire safety, and on and on. But also what makes our program a bit unique is that we also are over risk management and insurance, which is the brown. And then the light blue to the right is the occupational health program. So that is the components of the SHRM program. Now here, if you kind of focus up at the top of that diagram, that is the org chart. And one of the things that's made us famous is that in the safety business, on a good day, nothing happens. But we've become really adept at collecting data to be able to tell the story about all the work that went on behind the scenes to make nothing happen. And so if you look at these color-coded activity reports there, you'll see how they mimic the org chart. And then equally important are these kind of yellow pieces of paper, and that indicates the customer service surveys that we do. So what we do, we've learned over the years to do targeted surveys for these client bases. So for example, the people who work with sources of radiation, we have the activities we undertake to support that program, but equally important, we ping the users and ask them just simply, can you access the information you need? Is your waste getting picked up? That sort of stuff. And all that flows down into the bottom, which is the actual outcomes of the safety program. So you can see labeled here, we got the program activities, we got the customer service assessments, and then I'll get into the ultimate outcomes and comparisons at the tail end of this presentation. So typically for major research universities, you have a radiation safety committee, you're required to do that. You have an institutional biosafety committee. More and more universities are developing a chemical safety committee to provide some oversight of the use of particularly toxic or hazardous chemicals. But there are many other safety concerns that are not caught by that. So for example, difficulties with people commuting by bicycle, with traffic control, or maybe security issues or workplace violence or whatever. So about 25 years ago, the university, we gobbled together a group called the Safety Council. And what we've learned, this overarching Safety Council has turned out to be very powerful for us. And that's really the crux of this presentation. And I will tell you that we are invited, because of the materials I just showed you, we are asked to go out and do collegial peer reviews of safety programs for universities across the country. And commonly we find there is not an overarching safety council, or if there is one, it doesn't function at a very high level. So with the Safety Council, what it consists of is a shared governance arrangement where the leadership is the chair and there's a vice chair, and those persons are appointed by the president. And it's typically, historically, it's been an occupational medicine physician, but not always the case. It could be a senior level faculty member as well. And it also includes the chairs of those respective specialty committees, radiation, bio, and chemical. And then on the lower left, you can see we have representations from the student groups, the class-side staff groups, and the interfaculty council, which is the faculty from all the schools. The middle box is then all these other service units that have their involvement, either they're folks that are very attuned to health and safety issues like animal care, for example, but we also have other key groups like legal affairs, public affairs, wellness, and the like. And then on the far right is ex officio representation, which is myself, by the way, and the other leads of those programs that I showed you in the org chart. So the reason I'm sharing all this with you is, I don't understand why it's not advanced. Okay, and here's a screenshot. We just had a meeting the other day, and because of COVID, we've been meeting remotely, but just thought you might like to see the vast array of individuals. And what's funny to me about this picture is we've got some folks on full screen, and then over on the right, you've got folks that are maybe not, their camera's not running and the like. So what I'd like to describe is 3 examples of where the Safety Council is considering a broader perspective. And the first one had to do with workplace stress. The Employee Assistance Program noted that they were getting more and more folks that were seeking their services, but it was unclear exactly what the root causes of this were. So with employee health and the collaboration of a few other representatives, they went out with a institutional-wide survey asking about what were the causes of workplace stress. And interestingly enough, it turned out to be not a health and safety issue, but financial management. And so EAP then took this information and actually enlisted the assistance of various organizations that provide online learning tools for financial management education and services, and it's been well received. The second example is these COVID-related issues where we were getting feedback from the clients that we serve that they were getting frustrated with constantly changing recommendations and uncertainty. So we really had to ramp up our communications and make sure that we showed that the recommendations that were going out, that they were actually date stamped, because things were changing so quickly. And then this last one, I think you'll find very interesting. The safety programs thrive on doing routine surveillance, where we go out and have checklists and we check on lab safety or check on workshop safety or something like that. And what we learned was years ago that the last part of the checklist, we add a question that says, do you have any safety concerns? And 80% of the time that we asked that question, people did have a safety concern that they conveyed. But interestingly enough, 80% of those items noted were not on the checklist. They were issues that were a bit outside of the purview that we had designed for these checklists for the various work settings. So that turned to be a very powerful means of engaging the employees and students in the protection of their own safety. Well, then the police department spoke up and said, hey, we really like this. Could you do us a favor? And while you're asking that, could you ask, do you have any safety or security concerns? And that has been really enlightening, because now we get comments back such as, this individual is undergoing a nasty divorce and the former spouse has been lurking in the parking lot. We find other things that are missing, and on and on and on. And so this has turned out to be a very, very powerful tool that is something that's outside of the normal purview of an occupational health and safety program. It was all driven by comments by this workplace, the Safety Council coming together with that cross-disciplinary approach. So at the end of the day, what upper administration wants to know is how are we doing? And we I'm pretty much going to have this carved on my tombstone that I think for occupational health and safety programs, the key performance indicators are these four: losses, compliance, finances, and measured client satisfaction. And each of those has two subsets. So under losses, I report to the president annually on how many people got hurt or ill and how much property got damaged. And then compliance, how many external agency inspections did we have? And internally, we go around and check on stuff as a preventive means. And then finances, how much do we cost and how much cost avoidance or revenue generation do we have? And that balanced out then with measured client satisfaction, not idle complaining by somebody in the elevator. So that's turned out for me to work out very well over my 40 years. And it's has been well received by now 8 different presidents of the university and various leaders as well. So it seems to also, when we do these peer reviews, it seems to be warmly received at other institutions as well. Now, with regard to how are we doing with regard to worker well-being, that's something that Safety Council is grappling with. Now, there is this NIOSH WellBQ survey tool, and we've shared that with the Safety Council. And I will tell you that the council has said it looks good, it makes a lot of sense, but it's likely that participation will be low because it's quite lengthy. So they're debating, how we might consider trimming that down, which is something that's acknowledged within the authors of the program there. Another way we're looking at measuring is possibly measuring the utilization of institutional services, such as how many people access the EAP program. There has been discussion about the possibility of de-identifying and look at health insurance utilization. That's outside my sphere of expertise, so I would have to leave that to others. But I do think that as part of these routine surveys we do, there are these indirect indicators, such as we've been selected by the Houston Chronicle as a top workplace. And in fact, we're just listed. I just got the notice yesterday. We're listed in Forbes magazine as one of the top workplaces in Houston as well. And then we have these student perception surveys and then the actual injury and illness data, which brings me to the ultimate outcomes. And this is probably one of the more profound graphs I've ever made, because what it shows is the Bureau of Labor Statistics, this would be for employees only, by the way, for NAICS code for hospitals, and then the NAICS code for universities. And when we first charted this data, I thought that we would fall somewhere in between, but lo and behold, UT Health Houston falls below both. And it is interesting, if you look at this data, you can see the uptick due to COVID-19 on the hospital and the downtick for the universities, and that has to do with the impact of overloading the hospital with all sorts of demands, but then lower actual presenteeism, so to speak, for employees in the workplace. So I expect that to level out sometime in the future. So, so to summarize this, each of us only have one body. It goes from home to work and then back home again. Organizations are realizing that consideration of the total worker's health and worker well-being is important, and it's good for business. I think that OHS programs can reach across the aisle to engage other organizational units to work together to see this bigger picture. And by any measure we currently have, the Safety Council has proved to be a very effective shared governance entity for the university. And we look to build upon that experience by using some version of the WellBQ tool. And I think we can gauge the impact of these collective efforts. So I appreciate this opportunity to chat with you, and I will not advance the slide because I think, Dr. Felkner, you're going to do that next. So I'm going to back away and turn off the video.
Okay, thank you, Bob. And thanks for that look at the partnerships that you've developed to move OSH practice to a more holistic model. And now we'd like to welcome Dr. Scott Ernest and Commander Liz Garza to our virtual podium. Scott, Liz.
Hey, good morning, everybody. It's great to be with you. Commander Garza and myself will be talking about work we have done in the construction program with our many partners to address the significant hazards in the industry. Construction includes residential and commercial building, but it also includes heavy and civil engineering construction like water and sewer lines, building highways and bridges. Also, it includes specialty trades like roofing, masonry, plumbing, electrical work, drywall, and painting. And each year, we help to lead the national campaign to prevent falls in construction and the associated stand down. Falls are a leading cause of construction industry fatalities. Preventing falls in construction is a top strategic goal for the sector and the NORA Construction Sector Council, along with OSHA and CPWR, who are instrumental in shaping and leading the campaign. Construction is one of the most dangerous industries in the U.S., with over 1,000 fatal occupational injuries and 74,000 non-fatal injuries among construction workers in 2020. In 2020, the U.S. had 4,764 fatal occupational injuries, an incident rate of 3.4 per 100,000 full-time workers. 1 in 5 worker deaths in 2020 were construction related. Construction has about 7% of all U.S. workers, but about 20% of the fatalities that occur, the largest number of fatalities reported for any industry sector. The mission of our program is to eliminate construction fatalities, injuries, and illnesses through a focused program of research and prevention. The NIOSH construction program is responsible for construction research that occurs across the Institute. This includes the divisions, labs, and offices in states like Ohio, Pennsylvania, and West Virginia, where a great deal of the work is occurring, but also in Spokane, Denver, Anchorage, Atlanta, and Washington. Because of the safety hazards that are present in construction, the Division of Safety Research and the FACE program that investigates fatal injuries also plays a particularly important role. The NIOSH construction program oversees 3 types of research: intramural, extramural, and the work of the National Construction Center, or CPWR. So the intramural, that's NIOSH employees primarily, folks within the Institute that are conducting their own research through the NORA process. Also, extramural, that would be the universities that we fund, and then again, the National Construction Center, or CPWR, which plays a vital role in our occupational safety and health efforts. The National Construction Center is competitively funded through a 5-year cooperative agreement, and we're currently seeking applications. We have a really, really close and very good relationship with CPWR. Research to practice plays a large role in our current construction research portfolio, and the National Construction Center leads much of this effort. OSHA's Construction Directorate is also important in achieving progress towards greater impact within the industry. This is a slide from CPWR's data center. And what it shows is on the y-axis is the number of fatalities that are occurring per year, and on the x-axis is the years between 2011 and 2021. And the emphasis is on the construction focus 4 hazards, which represent nearly 60% of all fatal injuries in any given year. So broken down by color, the orange color is falls, followed by dark blue, which is struck by incidents, light blue, which is electrocutions, and light orange, which is caught in or caught between. From 2011 to 2021, falls to a lower level accounted for a majority of fatal fall injuries annually. The average over this time period was 339 fatalities a year. There were increases in the number and in the rates during this time period. Struck by injuries accounted for an average of 165 fatal injuries annually. The number and the rate of these injuries declined during the period. Electrocutions had an annual average of 74 fatal injuries, and caught in between averaged 58 per year. I also wanted to mention the OSHA's top 10 violations each year. This slide shows the top 10 for 2021. Fall protection, or 1926-501, remains at the top of the list for the 11th year in a row, followed by respiratory protection and ladders. Hazard communication, which spent the last several years at number 2, moved to the 5th spot in 2021. If you look at this list, the items in red, 4 of the top 10 violations are related to falls: fall protection, ladders, scaffolding, and fall protection training. So the thing about this isn't that uncommon. Year after year, if you look at OSHA citations, they're frequently citing issues related to falls, specifically in the construction industry. Although incredible advancements are made in safety each year, the OSHA top 10 list reminds us that we must continue to find areas where we can improve so we can better prioritize workplace safety. Next couple slides again are from CPWR's data center. This shows a breakdown of fatal falls from 2011 to 2021. Approximately 10.7 thousand construction workers died from on-the-job injuries. Of these, 65.5% resulted from focus 4 injuries. Falls to a lower level accounted for more than half, or roughly 54% of fatal focus 4 injuries, but 35% of all fatal injuries. Many of the falls occurred from roofs, ladders, and scaffolding. And then if you look at struck by injuries in the dark blue, struck by fatal injuries were the next highest at 17% of the total. Much of those struck by injuries occurred on highway road construction. In terms of non-fatal focus 4 injuries, from 2011 to 2020, there were about 780,000 construction workers who suffered non-fatal injuries. Focus 4 injuries accounted for about 40% of that number, and struck by injuries were 53% of the focus 4 injuries and 21% of all injuries during the period. The NIOSH construction program addresses safety and health issues across the entire industry. One of the strengths of our program are the many partners that we work with on a regular basis through our NORA Sector Council and our work groups and other interactions. This slide just shows some of the partners and collaborators: the National Roofing Contractors Association, Liberty Mutual, the American Road and Transportation Builders Association, Association of General Contractors, ASSP, NSC, the laborers, the North American Building Trades Unions. Lots and lots of partners that we work through to help us try to move the ball forward in the construction sector. Each year, we help to lead the national stand downs for both falls and struck by incidents. The falls campaign typically occurs in May. That's the image on the left-hand side. And then the struck by stand down occurs in April with the National Work Zone Safety Awareness Week. Our sector council and council work groups have been extremely involved in the entire process and have done just a fantastic job with the whole thing. I also wanted to call out OSHA, the Director of Construction, as well as CPWR for their leadership and their efforts in this area. The campaign was initially developed as part of the NORA Construction Sector Council. The campaign leaders, again, are NIOSH, OSHA, and CPWR. It's based on evidence of what is effective, and we continue to evaluate the campaign and look for ways to enhance its impact. The campaign and the stand down is a national effort to reduce the number of deaths and injuries from falls in construction. And the campaign slogan is "Safety pays and falls cost." The tagline is "Plan, provide, and train." Plan ahead, provide the right equipment that fits, and train everyone. The stand down is a one week a year, but saving lives is a year-round priority. Job sites change, crews come and go. So it's important that in addition to the 1 week a year that we focus on the stand down, we put greater emphasis really all year long on preventing falls and preventing struck by incidents. Implementing an ongoing fall prevention program is one way to show management commitment and improve supervisory leadership. I'll now hand it over to Commander Garzon.
As you heard, this campaign was launched through the NORA Construction Sector Council with NIOSH as one of the main campaign partners. We contracted with the Hannon Group to do an environmental scan that provided best practices and lessons learned from other related campaigns and programs. The Hannon Group then followed up with some English and Spanish language focus groups with small residential contractors and workers in 4 geographic locations to test potential campaign names. I'm just going to go back one slide. Taglines and products. Based on this research, we've launched Safety Pays Falls Costs on Work Memorial Day 2012. You can see here we have our campaign website, stopconstructionfalls.com, our tagline, and we went with more of a testimonial approach, factual, and a serious tone. From the beginning, we made it a priority to have our materials in Spanish, as 1/3 of all construction workers are Hispanic, with most of them preferring Spanish. La salud no tiene precio. You can't put a price on your health. The top right is the first OSHA poster for this national campaign. They've come out with a new poster each year for the annual stand down. In 2021, CPWR, the Center for Construction Research and Training, which is, as you heard, the NIOSH National Funded Construction Center, worked closely with the ANSI Z359 National Work at Heights Task Force and the NORA Construction Sector Council Falls Work Group to develop and administer a Fall Experience Survey. This aimed to fill in some gaps in information available on common underlying causes of falls from heights. CPWR designed the survey so that these findings could inform ASSP and ANSI voluntary standards to create more targeted resources for this national campaign, improve our outreach and education, and influence future research on fall safety, and share this data with the industry. They received 671 responses. However, participants were not allowed to continue with the survey unless they had been involved in, witnessed, or investigated a fall incident, which meant that 176 participants were dropped from the survey. Participants worked in several different fields, but the majority worked in construction. The height of fall. As one might expect, falls from over 20 feet were most likely to be fatal, accounting for 1/3 of all falls, but almost 2/3 of all fatal falls. Those who fell from over 40 feet made up 32% of all fatalities. It is important to note, however, that more than 5% of fatal falls happened at less than the 6 feet, highlighting the fact that even shorter falls can lead to serious and even fatal injuries. CPWR asked about the use of fall protection. Nearly half of respondents indicated that the individual who fell was not using any. When fall protection was used, the personal fall arrest system was the top choice. As far as the primary cause of a fall, the response selected most often was insufficient or ineffective planning. Following that was fall protection being provided but not used, and improper use of fall protection. Lack of relevant training was also highlighted as a major cause. Around 31% of respondents indicated that there was no training or they weren't sure, but the majority of those who fell had at least one type of training. The most common types of training were for the use of the specific fall protection and arrest equipment being used at the time, the OSHA 10-hour training, and then training on the proper use of the access equipment. Based on the environmental scan and on best practices for other campaigns, those early focus groups conducted, as well as the findings from this 2021 Fall Experience Survey, we continue to work to develop a broad range of educational resources, mostly in English and Spanish, but also have a new part of our website for resources in other languages. We work to disseminate them through a wide range of channels. To highlight just a few, NIOSH has a ladder safety app that provides user-friendly guides and interactive tools to prevent major causes of falls. One of the tools is an angle measuring tool. It uses visual, sound, and vibration signals to make it easier for users to set an extension ladder at the proper angle, which is 75 degrees, and to check the verticality of extension and step ladders. CPWR has an online ordering form where you can request free hazard alert cards. Examples included here, fall protection harness, scaffolds and ladders, as well as we have an annual hard hat or helmet stand down sticker. Both have been super popular with our workers, and CPWR usually runs out each year, even though they increase their printing capacity every year. These hazard alert are short image-driven materials that deliver simple, direct messages for protection against safety and health hazards faced by construction workers. They're available in two formats: printed cards folded to pocket size and the one-page PDFs. These printed cards are water resistant and built to last. They're often ordered for training and as handouts for toolbox talks. The NIOSH FACE program, the FACE Fatality Assessment and Control Evaluation Program. You can search by construction falls to narrow your search where you can pull reports of fatality investigations and what they found. The FACE program studies fatal workplace injuries and prepares reports with recommendations to prevent similar deaths. We often use these reports to develop some of our toolbox talks and other products. Be a safety leader. This 2.5-hour Foundations for Safety Leadership is available in English and Spanish. It's a highly interactive training program that teaches foremen, supervisors, and other frontline leaders on construction job sites about the costs of ineffective and the benefits of effective safety leadership, such as improved safety climate and reduced negative safety outcomes. Most importantly, includes information on critical leadership skills to use on the job site and presents students with different scenarios which they can review and decide which leadership skills would help address that specific worksite hazard. CPWR recently adapted this training to create the Foundations for Safety Leadership for Residential Construction. This course is designed to meet the unique safety issues found in the residential construction sector. In connection with this year's stand down in the national campaign, we had 2 Spanish language fall prevention webinars at the national level with OSHA CPWR that gave some practical tips on fall prevention, PPE fit, harness use, rescue planning, and other technical aspects. This was this year's stand down poster developed by OSHA, also in Spanish. Each year, CPWR conducts an evaluation of our national stand down based on OSHA Certificate of Participation database. When anyone hosts a stand down, they are encouraged to fill out the OSHA's online form to receive a certificate of participation. When they fill out the form, they're asked questions about their organization and their event. This data has gaps because it only records participants who complete the form to receive a certificate. As such, it's almost certainly an undercount of participation. I'm going to highlight some key results from last year's evaluation. You can read the full report at stopconstructionfalls.com. I'll start with overall trends. The top graph represents how many stand downs were reported as having been held over the last 4 years. The graph below looks at how many workers were reached in those stand downs. We saw a dip in participation in 2020 with the start of the pandemic that was most pronounced in events held. However, this dip was recovered almost completely as of 2022. Workers reach has stayed stable between 2021 and 2022. In 2022, there was 3,409 stand downs reported all across the US. Events reached a total of 450,175 workers. This map is color shaded based on the number of stand downs held, with the states having the most in Texas, California, Florida, New York, and Pennsylvania. Ponte listo. Oh, the Prevention Through Design workshop. Prevention Through Design, we have a workshop coming up this month in Boston, and this is a priority for both our, that we weave into both of our falls and struck by work groups. We have the website here if you're interested in attending. This is a series that we've had over 5 years of workshops working with Arizona State University. Ponte listo. Besides funding CPWR to be the National NIOSH Construction Center, we're also able to fund, as you heard, outside researchers. One of them, Professor Javach at San Jose State University in California, works doing research on Hispanic residential construction workers. He works to describe Latino workers and contractors' attributions of common construction injuries, including fatalities, to identify points of synergy and divergence to be leveraged for effective intervention. In 2015, the Overlapping Vulnerabilities Report, generated through a collaboration effort between NIOSH, at the time ASSE, laid bare this fundamental problem. That is, the perfect storm of elevated illness, injury, and fatality in the construction industry, borne by young Latino immigrant workers in small sector residential construction. To end our presentation, I want to focus on the most disproportionately affected. We know that 91% of construction companies have fewer than 20 employees. Those companies account for 75% of all fatal falls. We also know Hispanics make up 1 in 3 construction workers, and we know the rate of Hispanic workers who die from a fall to a lower level is 50% higher than their non-Hispanic counterparts. We also know from our FACE reports and the Fall Experience Survey, more than half of workers who died from a fall to a lower level did not have access to fall protection. I'll end with this quote. He escuchado de equipo que nos podría proteger para que no nos cayéramos. I've heard of fall protection equipment that could protect us so we don't fall. Pero no sé ni qué es ni dónde conseguirlo. But I don't know what it is or where to get it. Yo quiero trabajar, pero no quiero quedar inválido de por vida. I want to work, but I don't want to be disabled for life. I'll pass it to our next presenters. This, as you heard, is the trend that we are increasing in our rate for fatal falls in construction. Thank you.
Thank you, Scott and Liz, for that view of the partnerships NIOSH is engaged in to develop worker safety practices in construction. Our next and final speaker today is Dr. Mitch Rosen. Mitch, welcome to our virtual podium.
Thank you very much, and thank you to our previous presenters for your excellent presentations. I'm going to talk a little bit about collaborations that drive workplace health and safety, and what I'm going to talk about is some of the things that I think about as we engage in and develop collaborations, and then provide a couple of examples of collaborations that were either short-term or longer-term collaborations. So I'm at the Rutgers School of Public Health Center for Public Health Workforce Development, and a lot of our programs are collaborative in nature. We have several major centers that are part of our center here. First is our NIOSH Education and Research Center, the New York, New Jersey Occupational Safety and Health Center, funded by NIOSH. And that's been a partnership and collaboration for over 40 years. Our Atlantic Center for Occupational Health and Safety Training, which is a NIEHS worker training program. This was started in 1987, and some of the partnerships that were developed there continue, and I'll talk a little bit more about that later as one of the examples of collaborations that have successful outcomes. Our Atlantic OSHA Training Center, which is part of the OSHA family, if you will, is also a partnership of several institutions across Federal Region 2. And the fall stand down, the Spanish language fall stand down that Commander Garza mentioned was part of one of our collaborations between our partner in Puerto Rico and CPWR. So it was great to see that highlighted. And then our Region 2 Public Health Training Center is more about the general public health workforce and issues related to public health in our region. And we collaborate with several institutions on that area. So how do collaborations start? There are many ways that they can start, and I think some of them are intentional in terms of jointly working with others on an intellectual endeavor, or cooperating in one way which is not immediately connected to another agency. Sometimes there's an identified need. You intentionally have found a need, and you find partners that can help you collaborate to effectively address that need. Sometimes you're actively looking for those partners, sometimes it's by circumstance, and sometimes it's just by pure luck. Happening to being in the same room or the same area as somebody else, and these partnerships can start with just with a conversation and addressing something that is mutually beneficial to both of you. So some of the questions that I ask when contemplating a collaboration is, how will it help my own work? I want to be able to engage with partners that will advance my work and have a beneficial outcome for the things that I'm looking to do. I also want to make sure that the collaboration will help my collaborators work, and that it meets their needs and mission and goals. Because if it's only beneficial for one and doesn't have that mutual beneficial account, then there's going to be a problem that occurs. What expertise or resources are sought by each collaborator? So what are we all bringing to the table, and how can we make sure that those resources are used in the best ways that make our work better and most out there, so that the end product that we're looking to gain is the best it could be? And is there funding for the work envisioned? And if there is, how will it be shared? What's the time commitment? And this is a big thing to think about in terms of collaborations. What's the time that we're all going to put into this collaboration? Doesn't mean that everybody is going to put the same amount of time into it, but what is the commitment that is needed? What are you looking for from your collaborators, and how will you achieve the outcomes with the time that you need from that? Is this someone who I want to collaborate with? Are we equitably invested in the collaboration? Again, that doesn't mean that we all put in equal efforts, but that it's an equitable investment in terms of what we expect to put into it and what we expect to get out. And then what's the vision for the collaboration, and what are each of our roles to ensure that the collaboration is effective and has meaningful outcomes? So some challenges, time is always a challenge. We expect to develop collaborations, and time is an issue that needs to be addressed, and how much time is going to be put into it. Resources, divergence of ideas. Sometimes you start on the same wavelength and you start to diverge, and that's okay, because collaborations change over time. And the way it started doesn't always mean that it's the way that it's going to end. And people can come into a collaboration, go out of a collaboration, and then others can come into it. Commitment. Sometimes you think that you want to put in enough time, and you just find out that either you don't have the time for the commitment, or you're not committed to the ideas that you originally thought of. And trust. When developing collaborations, you need to have an understanding and trusting relationship with those you're collaborating with. Many years ago, when we started a program through the NIEHS Worker Training Program, we had worked with the labor union and with community-based organizations and a university. And the level of trust at the beginning wasn't so great. But through the establishment of the program, we developed trust in the relationships, and we're able to do great things together. So collaborations create capacity, and the benefits of the collaborations are great. One is sustainability, and one way to do this is through a train-the-trainer model. Having one of the organizations that has expertise in occupational safety and health working with others that don't have the same level of occupational safety and health, you can do train-the-trainer programs and develop this expertise in partner organizations. We mentioned the OSHA outreach, the OSHA education centers. One of the things that they do well is the train-the-trainer model for developing outreach trainers who then go out and train in the 10 and 30-hour courses. Responding to new events quickly. If you've got established relationships and collaborations, you can mobilize your community to be able to respond to something quickly. You can engage and train community members through existing collaborations and develop new collaborations based on the needs identified. An example is after Hurricane Sandy, a lot of us came together in New Jersey to develop training programs on mold and mucking and gutting and other issues to protect workers. We had a lot of established relationships in the New Jersey area, so that we were quickly able to work with others to develop training programs, identify populations, and get training out there. And after Hurricane Harvey in Texas, some of the lessons learned that we had in New Jersey and the established relationships that we had with Dr. Emery and others in his group there, we were able to go down there and share some of those lessons learned in the Houston community and train some of the workers and day laborers and others, so that the stuff that we learned and the important lessons that we learned in New Jersey were then able to be provided in other areas. And then developing new collaborations based on needs. One of the things that I never really thought too much about before Hurricane Sandy was all the different volunteer organizations, the volunteers active in disasters, the religious groups and other groups that come and help out and do a wonderful job in terms of responding to disasters and providing the needed information for community members. The volunteers generally didn't get safety and health training. So that was a void that we found, and we developed a new partnership after Sandy to work with an organization, the World Care Center in New York City, who had been training volunteers since after 9/11. So identifying that new kind of collaboration based on identified needs. And then trust developed between collaborators. Having that trust is really essential so that we can develop more in-depth relationships with each other and provide new training through cooperative discussions. The different collaborators that I work with include academia, government, nonprofit and community-based organizations, worker centers, private industry unions, individuals, and industry associations. Each of these have different types of partnerships and collaborations, and it's really beneficial to have different types of collaborators that can provide different resources and activities as you're looking to achieve a certain mission or goal. So one of the examples that I'm going to talk about is the NIOSH Education and Research Center's continuing education programs, which is a collaboration that's set up to share resources and provide webinars on two different particular topics, one on industrial hygiene and one on human factors and ergonomics. Whereas we all come together and we provide resources and expertise in these two areas, and then deliver monthly webinars that are well received across the country. You can see the URL that these webinars are hosted at the Berkeley ERC and two of the upcoming ergonomics workshops that are coming up. So this was a valuable opportunity for us to share resources and provide a valuable resource across the country for those who are interested in more information on those two topics. We've developed partnerships and collaborations to develop capacity in organizations. One of these is a collaboration with the good old Lower East Side, a community-based organization in New York City. It's a neighborhood housing and preservation organization, which is dedicated to tenants' rights, homelessness prevention, economic development, and community revitalization. And this started after Hurricane Sandy. We reached out community-based organizations who are looking to receive the OSHA 10-hour training, who would then be able to use that training to get jobs in New York City in construction and other areas. So this was really one of the steps in terms of job development and creating opportunities for individuals in the Lower East Side. How it's progressed is that Goals participates now in quarterly OSHA training programs, and they've expanded the types of training in their community members attend, so that it's significantly from providing several 10-hour courses to a much more intentional and developing capacity within their organization and the members of their organization. A long-term collaboration is our NIEHS Atlantic Center for Occupational Health and Safety Training. We have over 35 years of working together on hazardous waste, disaster preparedness and response, and environmental careers training. We focus primarily in Region 2, New York, New Jersey, Puerto Rico, and the Virgin Islands. And it started with a funding opportunity from NIEHS in 1987. And Rutgers was one of the original grantees as part of this program. And it's progressed over the years by new focus areas of training. Originally, it was just around 1910-120, the hazardous waste and emergency response standard. Over time, it's expanded to the environmental careers worker training program. It's to the hazardous disaster preparedness training program. We've done infectious disease, Ebola, and other training areas as disasters and other issues have come up in this country. And each time that we've had those new areas of training, we've developed new collaborations to meet the needs that we're faced with. We do training across the population of our region. And we do broad range of populations because we have different organizations within our center that have different target audiences within their own catchment areas. So it brings together a variety of organizations that can meet a broad range of training needs and populations. So I'm going to focus a little bit more on our environmental careers worker training program. And this was established in 1995 and with Rutgers and the New York City District Council of Carpenters and a bunch of community-based organizations that have come in and come out of the collaboration over the years. This is a career development program for the construction trades. It's a pre-apprenticeship program. We've trained over 1,000 individuals. The benefit of the partnership here with the District Council of Carpenters is that it's a New York State Department of Labor approved direct entry program, which allows our pre-apprentice trainees, graduates, to go directly into the apprentice program at the Carpenters Union. So it's really a nice career development program that allows our trainees then to get into the construction trades. And the target population is from low income and underserved populations. And looking at some of the information about our incoming trainees, 13% were unemployed for more than 1 year. 25% come from households receiving public benefits, and 15% are living in low income housing. And the average hourly wage was $9.50. And the annual average income over 12 months prior to enrollment was just over $9,000. And 94% of the incoming trainees were from minority or disadvantaged populations. The outcomes are just amazing, where we have an 85% job placement rate from graduates. We have 87% retention for 1-year jobs and 78% long-term job retention. It's increased income for families served, with 72% of our graduates earning over $50,000 a year. So you can see that this type of collaboration, it provides health and safety training, it provides construction skills training, it provides math and reading skills and other skills to help individuals improve their lives. And having this collaboration between the Carpenters Union and Rutgers and community-based organizations is what makes it work. So collaborations drive workplace health and safety. And when looking to develop collaborations, let's figure out what the purpose of the collaboration is. Select appropriate collaborators so that you can address and meet the needs of what you're trying to do. As you're going through your collaborations, understand the benefits and challenges and look to address those, and foster growth and changing roles, because collaborations are not stagnant. They change, partners change, the goals of the collaboration may change, and those are good things because you're growing and you're changing and addressing new and emerging needs. So thank you for your participation, and I will turn it back to Sarah.
Thank you very much, Mitch, for that great discussion of the different methods you've developed and to both engage collaborators and partners in driving workplace health and safety across industries and worker groups. On behalf of NIOSH, we'd like to thank all of our speakers for their presentations on the innovative approaches they've developed to leverage collaboration to address key challenges in occupational safety and health practice. This concludes the presentation portion of today's webinar.